A decade ago, the Taliban launched an anti-vax campaign in Pakistan. Well, how successful was it, and might it undermine the success of COVID-19 vaccinations in the region? Hello, Monica, welcome.
Hi, Tim. Nice to be here.
Now, Monica, your paper evaluates the impact of a Taliban anti-vaccination campaign, and the story about this is something like something out of a spy film. To get the story for this, first of all, we have to go back to the hunt for Osama Bin Laden, don't we, 10 years ago? How are these events all connected?
Right. So it's quite a bit of a story. So let me first say that the Pakistani Taliban have been trying to discredit state services and health services in particular for a long period of time. However, there was something that happened in 2011, as you said, that relates to how the CIA went about capturing Bin Laden, that really changed to a great extent the game, right? Particularly because all of a sudden lent a lot of credibility to many of the rumors that the Taliban were trying to spread. So what happened, and this brings us to the spy film that you were referring, although a very sad film because there is some truth to it, is the following. So in 2011, as all of you will remember, the CIA got this piece of information suggesting that Osama Bin Laden might be hiding in a particular compound in Abbottabad, Pakistan. But before launching an entire operation that will entail invading another country, naturally the CIA wanted a definitive proof that Bin Laden was hiding there. So then they had this brilliant idea of organizing a fake vaccination campaign. So what they did was to hire an actual Pakistani doctor that started doing some low-scale vaccinations in an area close by to the compound. So as far as we know, these vaccines were safe and were appropriately given. But the critical thing that outraged many people was that the purpose of this vaccination was essentially trying to access the compound where Bin Laden was suspected to hide and try to get DNA samples from the children living in the compound, because that would have been a telling proof that they were related to Bin Laden and that Bin Laden was hiding there. So essentially 2 months after the actual capture of Bin Laden, this whole story, this vaccine ruse, was disclosed to the media in an article by The Guardian, the British newspaper, that described all these events. And this caused naturally a roar both in Pakistan and abroad about the fact that health officials or health practitioners were engaged with the CIA in an espionage operation. So then the dramatic effect is that this all of a sudden lent credibility to many of the rumors that the Pakistani Taliban were spreading, that were suggesting that health workers are not to be trusted, and their efforts to vaccinate kids might have some hidden angle to it. So all of a sudden, this sadly lent credibility to these type of rumors.
Yes, precisely. What sort of things did the Taliban say about vaccination?
Yes, so the Taliban had been trying to discredit vaccine through a number of rumors. Some of them tried to target a religious aspect of the vaccine. So, for instance, they said that vaccines were made out of pig fat and therefore it's un-Islamic to take them. Other times they argued that vaccination is part of a strategy of Western conspiracy to sterilize Muslim girls. And particularly after the Guardian article disclosing this link with espionage activities, they leveraged on this new piece of information and started saying, don't trust health workers, they might be spies, they might be engaged with the CIA, they might want to harm your kids. So that's the type of things that they were saying.
And do we know if people in Pakistan believe this propaganda coming from the Taliban?
So there is substantial anecdotal evidence that was sadly the case, right? So in the paper we describe a few anecdotes. Some of them are quite sad, when some parents argued that they trusted radicalized Islamist leaders saying that vaccines are not good, and then they didn't, following that advice, they didn't administer them to their kids, and sadly some of them got infected of polio that later on paralyzed some of these kids. So there are some anecdotal evidence, and very sad that some parents lend credibility to these things. Of course, documenting that empirically, it's hard. One piece of evidence that we get from our paper that particularly speaks to lending credibility to these rumors is the fact that we have stronger negative effects for girls relative to boys, which is consistent with lending some credibility to the rumor that vaccines were a strategy to sterilize girls.
Of course, you wanted to go much further than this anecdotal evidence in your paper. Where can you get the data that means that you can establish a causal link from this campaign to the health outcomes?
Right. So the main data source that we use is the Pakistani Social and Living Standards Measurement. This is a very large household survey that happens every 2 or 3 years in Pakistan throughout all the districts. And we focus on the two waves that happen immediately after and before the disclosure of the piece of information. But that leads us to a very large sample of children. So we have 18,000 children in our main sample. Now, for each children, we do observe their whole vaccination record, so all the vaccines that they have been administered to them. And we do observe the date of birth of the kid, as well as the district of birth. So essentially, with this information, we build what we call the diff in diff type of strategy, and we compare the vaccination behavior of children across districts of Pakistan and across, depending on their timing of birth. So our working assumption is that children living in areas that had more Islamist support, is more likely that their parents were exposed to this anti-Taliban propaganda, right? And of course, children born shortly after the disclosure of this information are much more affected than children that are already older, because the vaccination decision had happened sometime in the past, right? So with this, exploiting these two sources of variation, the district variation, which is a proxy of exposure to the propaganda, and the timing of birth, which we measure very precisely at the month level, we can convincingly estimate the effects and also trace the dynamics, which match quite well our prediction of when we expect to see the effects kicking in.
So, Monica, how big was the impact on vaccination rates?
Right. So to give you a sense, what we find is that if we compare some district with very low support for Islamist parties, like in the 10th percentile of the distribution, with another district with very high support, which is the 90th% of the distribution, we can estimate like a 11 percentage points reduction in the likelihood that any kid is vaccinated, right? So that corresponds to a 30% decline in the vaccination rate. So once you take this extreme comparison from the least to the most Islamist support districts, we can find a pretty large and negative effect on vaccination rates, which is linked to the vaccination to the vaccine ruse and the subsequent anti-vaccine propaganda.
Can we, from this, extrapolate to estimate how many more children suffered from disease as a result?
Right, so we do obtain also data on the number of polio cases at the district and year level. So for these results, we no longer have the detailed monthly variation, the timing of birth, but nevertheless, we do find effects that suggest that more kids were infected of poliomyelitis due to these events. And the effects are also large in magnitude. So again, with this comparison between the 10th to the 90th percentile in the Islamist support distribution, we find 1.6 additional cases of polio per month and district, right? Which one case might seem small, but that's almost double the average number of cases per district a month in Pakistan. So I would say that given the severe negative welfare effects of one extra case of polio, I would say that the welfare implications of the disclosure of this information are large.
Is this just an impact on vaccination rates for polio, or was there a bigger impact on trust in medicine in general?
Right. So we wish we would have better measures of direct trust in medicine and health workers. Unfortunately, for Pakistan, that was not available. But what we do find, what we did explore, is to see effects on other forms of health-seeking behavior that could proxy for this trust or engagement with the health services. And we do find also substantial negative effects. So after the disclosure of this information, it's less likely that parents consult formal medical workers when their kids get sick. Interestingly, we do find that they increase their health-seeking behavior to non-formal doctors, right? So traditional healers and the like. And consistent to that, we also find that it's more likely, after the disclosure of this information, it's more likely that they seek help from traditional birth attendants when they have another kid, right? So while these are not perfect measures of trust, it's consistent with this idea that these events spill over into broader measures of trust in the health service in general.
What's going on here, Monica? Is it that people believed the propaganda and they chose not to vaccinate their children as a result of this, or might it just be that people are afraid of reprisals from the Taliban?
Right. So that's a very good question as well. So once we provide substantial evidence that the effects seem to be demand-driven, one natural question is, but what changes that vaccination-seeking behavior? Is it, as you said, that they distrust the vaccine or health workers, or it might just be that they are afraid of the Taliban? It's hard to tell these two stories apart, but what we do in the paper is to try to obtain a proxy for presence of the Taliban or conflict with the Taliban, because we think that in regions where the conflict of the Taliban might have been more intense, it's more likely that people are more afraid of these reprisals, right? So in the paper, we do kind of a horse race analysis, trying to have our measure, our preferred measure, which relies on an ideological proximity to the Taliban, with this other measure that relies more on the direct presence of the Taliban and the conflict of the Taliban. And we find that all of our effects are coming from this ideological proximity to them, right? Which is suggestive that it's not being afraid of reprisals, is more that this greater exposure of the propaganda and so on. But it's very hard to tell these two stories apart. So I wouldn't be surprised if, to some extent, both of them played some role into the story and the effects.
Monica, this is important because we're now at the beginning of what's probably going to be the world's largest ever vaccination program. And do we think that maybe problems like this could have destroyed trust in vaccination and the COVID vaccine forever? Or is there something that, for example, health workers in the region can do to repair that trust?
So we do find in our paper that the effects are not persistent for a long period of time. So what we mean is that for the kids born in the year after the disclosure of the effects of the events, they do have a negative and persistent effect on their vaccination outcomes. But for kids born a little bit later, about 2013, there seems to be a decay in the negative effects. So these kids seems to have a better prospect in terms of vaccination. And the interesting thing is that precisely in 2013, the health workers in Pakistan started engaging much more directly with this vaccine skepticism. So they implemented programs in which local religious leaders will join the vaccination drives and endorse the vaccines, or they also show videos of important religious leaders endorsing the vaccines and saying that the vaccines were okay. So the fact that our effects kind of die out at the time when these other interventions were at play seems to, at least it sends to me, an optimistic message, in the sense that it's likely that through these type of interventions, trust in vaccines and trust in the medical sector could be recovered. And that's along the same lines of new research that is being done that seems to be, doing interventions. For instance, in the US right now, there is a study where they show that messages of culturally tailored messages of doctors advocating for protection measures of COVID protection seems to have positive effects on compliance on these protective measures. But the interesting thing is that for particular communities, for instance, from the Black community in the US, the messages was much more powerful when the doctor was also Black, right? So I think that this whole story and our results suggest that tailoring the messages and the intervention to the particular cultural situation and to the sources of the ultimate vaccine skepticism seems to be important. I think that's a lesson that deserves further research, but also consideration in policy circles in the as you said, in the subsequent large attempt to vaccinate the world from COVID-19.
Well, that's potentially a positive message coming out. What's a really important and quite worrying piece of research. Monica, thank you very much.
Thanks for the interest.
If you want to know more, this is a CEPR discussion paper. It's called In Vaccines We Trust, the Effects of the CIA's Vaccine Ruse on Immunization in Pakistan. And the authors are Monica Martinez-Bravo and Andreas Stegman. Well, thanks for watching. As ever, you'll find plenty more research on the impact of COVID-19 in COVID economics, which is free and open access at cepr.org.